because I want to be respectful of everyone's time. Good morning, good afternoon, good evening, everyone, and welcome to the second session of the Alive Learning Forum. My name is Rasha Fadlallah, and I am one of the forum's co-chairs. It is a pleasure to chair today's conversation on how to set up a living evidence partnership. For anyone joining for the first time, or even if you have been here from the start, which we are grateful, just a quick reminder of what this space is all about. So ALIVE is the Alliance for Living Evidence, which is a global network of people and organizations from across the evidence ecosystem working together to develop and test a new approach, aka the Living Evidence Partnership to evidence synthesis and use. And the Learning Forum, which is this forum, is our space for collective learning. This is where researchers, policymakers, practitioners, and citizens come together as a global diverse community to share their experiences, to challenge assumptions, and to learn from one another about what works, what doesn't work, and everything in between. And the forum is meant to be a dynamic and responsive forum, evolving with the questions, the experiences, and the ideas that you, our audience, bring to the table and to the conversations. In our first session, we explored what is living evidence and what does it mean for your organization. Today, we take the next step, focusing on how do we build partnerships for living evidence. Certainly, living evidence partnerships are the backbone of this work and the work that ALIVE does. And as many of you may know, they demand trust, coordination, and a shared commitment to adapt and respond in real time. That's why today's conversation is important, because we believe that partnership right is what enables the whole system to work. We are fortunate to be joined by two outstanding speakers today. So we have Dr. Mikey Rosato, who is a specialist in designing, implementing, evidencing, and scaling up community-led innovations. He has over 25 years of experience engaging communities to co-create solutions to global challenges. Mikey brings a creative and inclusive lens grounded in the belief that communities are not just beneficiaries, but co-creators of meaningful changes. We also have Dr. Sheyu Li, who is an associate professor and a clinical diabetologist at West China Hospital, Sichuan University. Dr. Li leads several pioneering evidence initiatives, including the West China Recommendation Platform and the WeCode Diabetes Database. His work spans guideline development, digital tools, and clinical care, with a particular interest in living practice guidelines and network meta-analysis in the field of type 2 diabetes and related conditions. We are thrilled to have both of you with us today, and thank you for making the time to join us. And please feel free to introduce yourselves later on if I missed anything. So before I give you the floor, I just would like to go over the objectives of today's session. So certainly, by the end of today, we are hoping that you will gain a better understanding of the concept of living evidence partnership, learn about some of the key steps to establish a living evidence partnership, share real-world examples and lessons learned, not only from our speakers, but also from you, our audience, and discuss strategies for sustainability and scaling, which is critical for the partnership. And most importantly, we want to learn together about living evidence partnership. And as we showed you in the first slide, this is how we will structure the session. So we will start with a 15-minute presentation from both of our speakers. Then I'll open the floor for question and answer and discussion. And hopefully you will be brave enough to turn on your camera and to have a conversation with our speakers. And we'll also invite you to contribute to Zoom survey question. And finally, we will wrap up by looking ahead to the next session. Just a few quick housekeeping notes before we proceed. So please keep the microphones off until invited to unmute. Certainly, if you experience any technical issues, please message us in the chat. The session is recorded and will be shared online. You have all been added to our mailing list for future events. You can unsubscribe from that list at any time, although we hope you don't. If you have any queries about this or any of the forum session, you can contact us at the email shown in the slide. And most importantly, I want to emphasize that we want you to engage actively. Your participation is what makes this a living space for learning. So we don't want it to feel like a plenary. We want it to have a conversational style. So we are relying on your contribution during this session. And now, without further delay, I'd like to invite our first speaker, Dr. Li, to begin. So, Dr. Li, the floor is yours.
It's actually going to be me first, if that's okay, Rasha. I'm happy to take over. If I can
Okay,
share.
sure. My
Thank you.
apologies.
No problem. I'm just going to share my slides. Hopefully, I will share them here. Hopefully, you can all see my slide deck. Thanks a lot again for inviting me to talk. I'm excited to talk to you all, but also to speak with Dr. Sheyu, who I think we can learn a lot from. He's been working in a partnership for a lot longer, and was able to kind of provide some ideas of what happens down the road in a partnership. I'm going to focus a little bit more on that early stage of setting up a partnership here. I thought it'd be a good place to start to think about what do we mean by a living evidence partnership. And here we mean a space where evidence users, producers, and knowledge intermediaries are organized to work collectively, and that's critical here. It's bringing those disparate needs and agendas and people together to work collectively to close the gap between research and action by developing a living evidence base that meets the needs of the evidence users. There's a critical piece of this process is taking people who may traditionally be working separately or on different issues, bringing them together to work collectively to deliver a collective outcome. And understanding partnerships in that way helps us to place partnerships on a continuum of organization. So partnerships are one step in a range of organizational forms moving towards a movement. And what's important about placing it on this continuum is understanding where they come from and also where they can go. So partnership comes from, in the very first instance, individuals who have a concern, in this case, a concern around the evidence, trying to make decisions around certain issues in their topic area. They may already start working together in small mutual groups and meeting with other individuals from other organizations or within their own organization, but maybe in a more quite unstructured way, starting towards solving the problems they have in that evidence space, in that evidence ecosystem. At the next step of organization, those groups start to become a bit more organized. There, those groups start to have some sort of leadership structure, maybe some sort of governing structures. They start to be able to guide and drive their work more in a more targeted fashion towards the outcome they're looking for. At the next stage, those organized groups will start meeting together in partnerships. And that's why we talk about living evidence partnerships, where those different maybe groups are based within the user groups, groups of evidence producers, groups of evidence intermediaries will start working collectively together to achieve their objectives collectively. And that's where the evidence, the alive living evidence partnerships live in this continuum. What's interesting about knowing where they come from is also knowing where they can go. So clearly, if we can keep building those capacities, keep those partnerships become even better organized, then they can also transition into movements where they can start to address not just their immediate concerns, but also the root undercausing issues that are affecting the ecosystem, the evidence ecosystem in which they work. That's clearly something we'd hope to achieve in the future. Understanding where partnerships fit in this continuum and looking at our journey and taking partnerships through this process, I wanted to share two observations in the early stages that I think are quite helpful. The first observation is that when we set up a partnership, it's often set up either externally driven or internally driven. Very simplistically, it's split between these two types. On the external side, many of our live partnerships are getting set up where a funder has identified a topic or issue and is commissioning us to support a partnership. Another is external in the sense that Alive itself is identifying topics and then going out to seek funding and inviting partners to join that process. And the majority of our partnerships at the moment are formed in this way, this external formation. But we're very keen to move towards on the spectrum more towards internally formed partnerships, where partners like yourselves and others working in this space are suggesting new topics, and with others coalescing around that topic, and then with a live support and facilitation, being able to achieve their objectives. And the last form I wanted to mention on the internal side is where partners are requesting to join existing partnerships. And I've highlighted this because this is where Dr. Sheyu will be able to share more experience of what he's had in that process in growing the partnership around type 2 diabetes. So that's the first observation I wanted to share, this idea of this spectrum between externally and internally formed partnerships, and the idea that we'd want to move towards more internally formed partnerships in future. And that's where this community and other communities we're working with are critical in this process. The second observation I wanted to share, and one I want to drill down to a little more detail, is that when we're setting up these partnerships, often we're coming to a group of organizations that are at this earlier stage of this continuum. So we're often either meeting with individuals who have a particular need in a topic area that they want to solve. More commonly, we're meeting with small mutual groups. We're meeting with groups of users or groups of producers or groups of intermediaries who are starting to think about working collectively, but they are doing so in a relatively unstructured fashion. They working cooperatively to try to solve a problem, but without necessarily the governing structures or the facilitation support behind it to move further along this process. And also, a lot of the partnerships we're forming we're starting to form are starting at a place of being more organized groups. That's where we have quite structured groups already working around an issue, but maybe they're slightly siloed. So structured groups of users again, or producers or intermediaries, working relatively separately from each other and overlapping only at the periphery. The role of Alive is to build the capacities wherever they're starting to transition into actually fully fledged partnerships where we can facilitate those organizations to work even more collectively together, to start to break down some of those barriers between them, and to be the neutral broker, the neutral sort of facilitation partner behind that process that allows them to build their capacities to become even better organized and actually start delivering as a partnership. And working as a partnership means they can deliver much greater impact in the area they have, but also as a stepping stone towards them fundamentally becoming movements in future. This process of facilitation, this role of an external agent as we view ourselves to supporting this process, is a process that has been well documented in the literature to support partnerships in many other fields and many other sectors. And in that literature, we identify a range of different areas of influence or domains in which we can intervene as a facilitator external partner to support the movement of those groups through that continuum. So we can support those small mutual groups or community organizations to become partnerships. And I've listed a few of those here, whether they're participation or leadership, needs assessment, resource mobilization, links with others, and asking why. A brief example of this is around participation, is to enable those organizations, those community groups to become more fully fledged partnerships. A key piece there is making sure the participation in those groups, they're accessible to the representation from a wide range of different groups working in that area. So some of the work we do here is mapping out who are the stakeholders or interest holders in those areas and making sure they're represented in the community of practice that we're trying to build, a partnership we're trying to build. Another area that we work very hard on is around needs assessment, is building those tools that allow the protocol development behind the syntheses we do to make sure they can involve everyone's views and are fully equitable across the representation of partners in the partnership. But the one I want to speak about specifically today is around organizational structures. Again, this is an area where we explicitly support those individuals, those groups, those community organizations to move into partnerships. And we do that by forming organizational structures within the community that allow them to become better organized. And that's something that we do at the early stages of setting up partnership, and that's why I want to focus on it here. These are some of the first steps we take in partnership setup. I want to share a simple diagram that I suppose explains this a bit better. If you imagine that in each partnership, we have a community of practice, we have a group of individuals, groups, organizations, all working on this issue, the evidence issue that we're specifically focused on. What we need to do is set up at least a group that steers that broader community practice, a group that's accountable for ensuring that the living evidence base that they're building meets the needs of evidence users. We also seek to set up advisory groups, which are those groups that we can consult or that can be consulted by the steering group as they build that evidence base to make sure it meets the needs of evidence users. And we also seek to set up tactical groups. Those are groups that are responsible for ensuring the evidence base meets the needs of the evidence users. So we set up these three types of groups within the community of practice to be accountable, to be consulted, and to be responsible for the actions of the community as a whole. And those groups obviously feed back to the community practice. They inform the remaining members of the community practice what they're working on. They share the evidence base as it's growing, the living evidence base as it's growing, so they can then use that in their own work. And I want to share an example, a live example of this at the moment. We are currently supporting a program of work called Destiny. It's a program of work funded by the Wellcome Trust, looking at the intersection between climate and health. And within that, we've started establishing a community practice, and that is a very broad community practice, looking at all the users, producers, and evidence intermediaries who are interested in the global climate and health picture, the global climate and health evidence picture. We've already established a steering group now within that broader community, which is to some extent representative of the community of practice, but will likely grow and change over time to make sure it maintains a representative nature compared to the community of practice. And that steering group is made up of specific users of global climate and health evidence, the people, I suppose, that are the primary targets of the work we're doing. Alongside that steering group, to support that steering group, we're also establishing advisory groups, which will have particular interest holders or particular groups with experience around climate and health that will be able to support the steering group to make those decisions, to make those approvals. That advisory group, in this case, may be either topic specific around climate and or health, or may also be technology specific. This program of work is very focused on using artificial intelligence and other digital tools to support the synthesis of the literature. So those different advisory groups will be established within this community practice, again, to represent the broader views and to feed into the steering group. And the last group we're setting up in the next few months will be tactical groups. Those will be the groups who are actually responsible for the work on the ground. They're the ones who will be developing the protocols and supporting the synthesis of or development of the maps and the synthesis and the living evidence syntheses. And those different groups are all organized within this community through a governance structure, where the steering group has approval authority, but is informed by the advisory group and the tactical group. The advisory group also feeds into the tactical group. And these groups are also feeding back to the community practice to make sure that, again, the views of all of the community practice are represented, taken into account, but also there's a leadership body in this community that can lead these decisions, approve these decisions, and make sure the community practice works effectively. So I wanted to stop there and just summarize that I think that we're at an interesting stage. We're learning ourselves about how to make these communities of practice, these partnerships, as effective as possible. The observations we've had to date, I've presented a couple, are really helping us to frame out how we do this in a more systematic and sustainable fashion going forward. What's underpinning all of this is really a clear theory that if we can start with less organized groups interested in an evidence issue, who have an evidence concern, who work in an evidence ecosystem that can be strengthened in some way, we can use very specific methods to bring them through a process of increasing organization that allows them then to deliver a much stronger evidence ecosystem to make the decisions in practice. And that process of doing that is supported by an external agent being alive. And that's a process we're engaging with under Destiny and other programs of work as we are doing at the moment. So I'll stop there. Hope I've kept the time pressure, and I'll hand over to Dr. Sheyu for his presentation, but looking forward to questions afterwards.
Thank you, Michael, for the very insightful presentation. Dr. Sheyu, the floor is yours. And after that, we will open the floor for discussions. Thank you.
Okay, thank you very much for the excellent presentation from Mikey. I'm very glad here to share follow the topic by Mikey about how to liaison the request from our partners. Thanks to the introduction, I'm a clinical professor and clinical diabetologist and endocrinologist in our hospital. So my work is I'm a clinician. So I treat patients with type 2 diabetes. And for the disclosure, I'm paid as a clinician in the West China Hospital, and I'm the co-editor-in-chief in receiving the fund from the Journal of Junior Diabetes. And I'm treating people with type 2 diabetes. And as you all know, that type 2 diabetes is emerging public health issues over the world, and everybody is concerning about type 2 diabetes. So the treatment is multinodular. So, but among them, the medication is among the cornerstone in the treatment and management of type 2 diabetes. But there are quite a number of the diabetes medications, and the emerging evidence and randomized controlled trials are going very long and growing very fast. And in 2016, the very first publication for the network meta-analysis for diabetes medication included only 301 randomized trials. But when we are now finishing our latest update for the type 2 diabetes, it is now 869 randomized trials with the follow-up duration higher than half a year. So if we are including the trials with 3 months follow-up duration, the numbers should be very large. And this is the evolution of our publication for this ecosystem from 300 trials in 2016, and now the newly accepted paper in the BMJ, including 669. And using this very rapid involving an increasing number of trials, everybody is trying to know about how the effectiveness and the safety of the diabetes medications, but it is very challenging for each stakeholders of guideline developers to doing this. So as a liaison in the Magic China Center, we are collaborating the Australian Living Evidence for Type 2 Diabetes and the BMJ Rapid Recommendation for Type 2 Diabetes. And we join these two guidelines together and use their PICO to make our living systematic review, and including 869 randomized controlled trials for this case. And in this systematic review and the evidence analysis, we produces quite big amount of information and estimates. And I would believe that this information and estimates is not only useful for these two guidelines. So we're building this lead, the living evidence alien for diabetes, to build a partnership to link the people from different countries who are interested in developing the guideline for type 2 diabetes, and we can provide the evidence synthesis work for them. And as mentioned by Mikey, I'm the core team in the tactical team, but we have to. Our work is not only to do the analysis, to facing on the screen, but we are also need to do the liaison with a need or request from the partners. And in this case, we have many communications or correspondence with our partnership, and we can classify our group that requests into two kinds. And the first one is PICO related, and the other is PICO unrelated. The PICO related question that the guideline developers from different scenarios or different countries, they have different PICO questions. For example, they have different participants. Some of them are allowing that we are the African country, so we need our all of this included trials to be African people, or they are going to develop a guideline for the elder people, so they need all the participants to be elderly, and our intervention, and in some and in our systematic review, we're including all spectrum of all the possible diabetes medications, but some of these medications are not approved in some countries like Canada or some other countries. And the Canadian people, the CARs, they may request some specific analysis for some specific drug that has been approved in Canada. So we can, in this case, we can tailor this selected medications. And in the regional medication, we consider medication as a class effect, but some guideline developers are interested in individual medications, and we can provide this kind of different things. And for the outcome, and some guideline developers have panels in writing the new outcomes, and someone like they have different definition for the same outcome, like the stroke and non-fatal stroke, and this kind of minor or differences. And also some guideline developers panels are requesting new subgroup analysis or statistical requests, and all they have their own baseline risk and MID based on their country their specific scenarios. But this request can when we are receiving this request, it is not the first task or first to do is to solve the request. The very first of us is to talk, to talk and to communicate, to let us know each other fully. And so the first case is to understand the request itself, and then we can solve the request. And when we are trying to
apologies
understand,
for interrupting. Would it be possible to wrap up in the next 2 or 3 minutes so that we can have a chance for the audience to ask the questions and discuss and reflect? Thank you so much, and I apologize for that.
Okay, I will do that. And first of all, just as Mikey said, we are going to ask why, and the request is not reflected. It's not reflected the need, but it reflects the need, but it's not the need itself. So the asking why is to know how to can understand what the need is, and so when we know the real need, and we are going to know it is the real need. So sometimes the panel member may ask some surrogate outcome, that's CRP, for the guy for the people with type 2 diabetes. It might not be the important surrogate outcome to impact the clinical decision making. So we may challenge the panel member of their partners if this kind of need is really necessary. And also some cases is as a solution because they are going to restrict or introduce a subgroup analysis. But some cases not the case of introducing new subgroup analysis treating the factor as a factor modifier, but in the effective solution is to introduce different baseline risk and risk stratification strategies. And to solve the request, we are going to, in some cases, some people just introducing the different names of the same outcomes, and because, for example, some people is asking that the new need of statin, lipid lowering therapy, and my case is that the incidence of dyslipidemia, they're the same thing, but they have different names or expressions. We need to understand this. And some cases we can solve the solution by removing a splitting interventions, just we had mentioned in the previous previous cases. And some cases, if your data cannot solve the case, we have to add new outcomes. And but that is something fortunate. But if your existing data cannot do that, we have to introduce new strategy. But in most cases, this situation cannot be solved by the same living evidence spectrum. And also for the alternative solution, it's also we can have some new alternative ways. And using some medical informatics cases, and we can also have to use some registry data set. We can do the very quick rapid review to inform the case if it is feasible or not feasible, and to provide some rapid reviews using some quick informatic ways. And also we have the M engine we have presented in the previous stream meeting, and it can allow us to do this great assessment very quickly. And so in summary, we should sit and talk to each other with a partnership and to reach the need, but not only the request. And the intercultural communication can be challenging, so we need to sit and talk very carefully. And the Living Evidence Consortium should be based on the sustainable solution for the clinical problem. So every solution should not be based on the start from the highest cost. And the novel technology such as medical informatics and artificial intelligence can accelerate the response to the partnership and prove the sustainability of Living Evidence Consortium. Thank you very much for your attention.
Thank you very much.
I have to take questions. Thank you.
Thank you to both of our speakers for those incredibly rich and practical presentation. We now have about 15 minutes, I would say, for question and answer. And this is an opportunity for you, the audience, to ask your questions, to reflect on what you've heard. So feel free to raise your hand and speak directly to our speakers or to post your questions in the chat. So this is the exciting part, and we look forward to having a conversation with you. So you can either unmute yourself and speak directly, or you can post your questions in the chat box, okay? So if you could ask our speakers today one thing, what would it be? Fiona?
Hi, thank you so much. That was they were really interesting presentations. I really enjoyed them. I just wondered, Mikey, if you could tell me a little bit about the funding. I'm just sort of interested in the sustainability of those networks that you've described, and so how they're funded. And I would also be interested in learning a little bit more about the sort of transparency around the processes for the rapid for the living evidence synthesis, and to what extent there's transparency around the protocol, changes to the protocol, and when there's a threshold for changing the guidelines, and how that process is managed. Thank you.
Thank you, Fiona. Do we have any other questions before we open the floor to our speaker? Okay, Michael, would you like to respond while we wait for others to pose their questions?
Yeah, so I can respond to the first question, Fiona, you had about funding. So at the moment, our partnerships fall into two buckets. The main bucket is a grant-funded one, where we're receiving external grant funding to support the partnership delivery. And that is clearly time limited. Sheyu has an experience on his partnership where it's actually it's funded by the partners themselves at the moment. There's no external funding currently supporting that partnership. So speaking from the experience of the other bucket, Sheyu can speak more clearly about his. The grant-funded partnerships do have a time limit. When I talked through some of those areas of influence, or those domains where we can build capacity, where we can organize these groups better, one of the key domains there is around resource mobilization. So we're hoping that through the process of building the partnership, by taking this external role and handing over responsibility and capacity to the partnership itself, we're also handing over responsibility and capacity to generate the way of funding that process themselves as well, whether that's through additional grant funding, or whether that's through co-funding, or whether that's through other mechanisms of funding. Our partnership hadn't reached that stage of maturity yet, so we don't know where we are, but we are building at the moment a number of different mechanisms for funding that might be useful for those partnerships going forward. And they're the ones that we'll then be able to provide to those partnerships as capacities, as a toolkit they can use to then support the funding longer term. So from those grant funded partnerships, that's a perspective. Sheyu might be able to comment more on the perspective from the type 2 diabetes partnership. As I mentioned, that's not externally grant funded. And also on the transparency and sort of when you have the stage at which that you review the systematic review or update the systematic review.
Thank you, Mikey, and thank you for Fiona's question. And in our living evidence for diabetes, which we call LEAD, we are receiving the continuous fund from our partners, and we are providing the very large systematic review for medication for type 2 diabetes. So if our guideline panel is going to do a guideline, is an essential question. But this kind of evidence synthesis can be very unaffordable for most guideline developers. So we use this platform to make it hard to communicate each stakeholder to each other. So our partnership can pay very low cost because they are sharing sharing our knowledge of synthesis in a sharing way. So we provide this information to many partners, and each partner can pay very limited information in the subscriptive way. Now we have 2 partners at the current stage in the initial part, but later when we are having a larger number of partners, the cost can be even lower. So each partners are willing to recruit new partners to reach us to provide the fund for our evidence synthesis and all the coordination cost of our living evidence consortium. Thank you.
Thank you, Sheyu and Mikey. So any other questions, reflections, remarks from the audience? Please feel free to unmute or to put it in the chat box. And while the folks gather their thoughts, I can pitch in some questions. So I have several questions, so I don't know where to start from. So I'll start from the typical one. So you both talked about building relationships. So how do you navigate power dynamics and ensure equity across different partners? So because it's something we are currently struggling with. So whose priorities are taken into consideration, and how can we ensure that the less established or the weaker partners are also seen and heard, and their priorities are also considered? So the equity component. So how can we ensure equity in such partnerships?
Shay, you happy for me to start? I think that's a really good question, and something we spend a lot of time and energy focused on. I think key to that is about hardwiring those considerations of equity from the very beginning of those discussions. So I showed a schematic of this broader community of practice with these groups within it. First is ensuring that the broader community of practice is accessible to everyone. So that's a communications challenge more than anything. It's getting out there and making sure that everyone is aware that they can join this community of practice. Then those specific groupings, that's a process of then trying to find a way to represent the needs and the views of the broader community within a sub number of people, a smaller group of people. And that's why we do a lot of work with the community of practice, identifying what are the key criteria that we should select on, and also building a governance structure that allows that group to constantly evolve. So there will be either fixed terms or rotating terms that people have within those steering groups and within the advisory group and within the tactical groups to make sure that people can move off and bring in new representation as needed, or can expand and contract as needed. The last piece I've mentioned, I suppose, is I showed those as 3 groups in that schematic, but actually they may be 6, 9, 12 groups. Realistically, as the community practice grows, it's impossible for 1, 2, or 3 groups to represent the needs of everyone in that group. And there it's about working with those groups to establish other groups that can also feed in representation into the decision-making bodies. So working at all those levels with all those different tools to make sure that if we think about this from the very beginning, we can get some way towards representation. But we're conscious that we're constantly failing, and that's why we're constantly trying to improve. And that's, I think, where, of the things I've mentioned, the one that's most critical is a flexible enough governance structure that allows refreshing and renewal in those decision-making bodies on a regular basis. So stasis is the enemy of equity, and we need to make sure that as things change, we also change to the needs of the broader community.
Thank you, Mikey. And in our type 2 diabetes practice, we treated all of partners as equal. So, but in many cases, it is really difficult to balance the quality and the equity, of course. In many cases, in perspective, but because we are receiving the requests from different partners, and we we treated them equal, and because most of them, most of the requests are mostly same because we have a fixed topic. So the quitting in our type 2 diabetes not exercise is not severe for the equity issue. But anyway, I think the case is that we need to care about the vulnerable partners. In the most cases, if we have to face some equity issues in different topics. Thank you, Raquel.
That's great, thank you. So we have a comment from Christine. So can Mikey review the typical timeline of each of the steps? So I don't know, Mikey, do you have the slides or?
I can share again, yes.
Yeah. So Christine, can you tell us which slide you're referring to specifically?
I think it might be this one. Let me show. I assume it's this one. Is that right, Christine?
Yeah.
Brilliant. So rather than viewing these as steps, these are forms of organization as they grow. So it's difficult to say exactly how long this takes, but to some extent it matters where we enter this process. And I mentioned on this slide that often we're entering the process of building the partnerships when there's already some organization happening. So people potentially have formed small mutual groups, or they've started to organize a bit more collectively already. At which point moving towards partnership is in the frame of months to achieve that process. But clearly there are things to happen. We need to build those organizational structures, make sure they're equitable as much as possible, build governance structures to make sure people can communicate and work collectively together. There are things to do, but that's in the time frame of several months rather than any more than that. The transition from partnerships to movements is much harder to predict, and that can take years, or also may never happen. That process of taking a partnership beyond looking at the immediate issues they're trying to address, so beyond the immediate gaps in the ecosystem they experience, and to looking at the root causes of those gaps, can take much longer to do. But usually we'd envisage within the first few months of a partnership, we'd be able to bring or build the capacities of those dissociated groups to work more collectively together. And that's where we will spend most of our energies and time, and before those groups can maybe transition into movements in the future. So sorry not to be able to give you an exact timeline. Also just to mention that once groups are established, they can move backwards and forwards along this continuum. At times, the partnership may be working very effectively together, but as people move or change, as individuals may leave those groups, things can move backwards and then forwards again. But hopefully that gives you an idea of the basic timeframes.
Thank you, Mikey. So let me check. Do we have any questions, any comments, any reflection? Yes, Daniela?
Thank you, Raja. Can you see me? Yeah. Can you hear me?
Yes, we can.
Yes. Hi, I'm Daniela, and thank you, first of all, to you and Mikey for the presentation. I think my question is a bit more about, or expanding a little bit more about the establishment of living evidence partnership, and I think it's a great, like it plugs in right with what you were just saying, Mikey, about the extent that there already needs to be certain organization in the groups. I would like to hear more about like what is considered already an organized group, because I've been wondering a lot about are there already certain types of products that they are producing certain organizational structures? What are the like at what stage is it already considered an organized group that can then transition to a partnership?
That's a really good question. And there are tools I can share that can help in that process, to where you can actually measure where they've reached along in this continuum. I suppose the piece that's always identified as critical is that they have those structures in place. If they have organized structures in place with the leadership that is representative of the broader community, that that leadership group or those leadership groups are working on behalf of the community as a whole rather than for themselves as individuals, that's where you can see them as being organized enough that they're really starting to engage in this process. The process of transitioning to partnerships is when you get those different organized groups working collectively together, and that's where they're working across boundaries. And the most common ones, simplistically, are between users, producers, and intermediaries. It's when those three are working together a bit more collectively, rather than rubbing up against each other, but actually collectively working together with the same objectives, organized with these structures in place. That's where you can really see them as being quite an organized group. Again, if you're interested, I'm more than happy to share some more documents and literature on this that shows you some simple ways to measure where you've reached up to in that process, and also identify potentially which capacities are missing that you can focus on. You can explicitly work on with those groups to try to push them further along into partnerships where they can work more effectively.
I would like, it would be great if you can send them over. Thank you.
Yeah, we'll do. Thank you.
Thank you. So we have room for one more question. So we have a question from Fermai. So are there specific themes or focus areas that are identified for partnerships, or does it depend on the partnership nature? Sheyu, would you like to respond to this?
Yes. I think it is very largely based on the establishment of the partnership, because when we establish the partnership, we have our target partnership cases. So in that case, I think every topic can have the specific one. So if we are going to establish it, we are going to have our inclusion eligibility criteria for our partnership. So this criteria can restrict the nature or the themes or focus of the area that the partnership is in. Because for the type 2 diabetes exercise, we focus on the guideline developers of this for type 2 diabetes medications. So I think Mikey may have better or more impressive explanation for this establishment of the eligibility criteria for the partnership.
Yeah,
Thank you, Sheyu.
thanks, Sheyu. I think you did a great job. So at the moment we're in a process of forming partnerships, and it's relatively open. So topics that are arising are we're trying to pursue, but we are going through a process of potentially in our strategy coming up with some clusters that we cluster around, and those clusters potentially are going to be around climate and health, and also around global health, vaccine delivery, and also potentially around public health, public information infrastructure and other things. So we're gradually building out those clusters as they gradually form. But we're also interested in looking at anything. So anything that is a potential issue where the evidence ecosystem could be working better or functioning better to deliver to users the right evidence at the right time in the right way, then we're very keen to discuss further. And Ruth just mentioned this could be a topic for a future session. So yes, we can share that in more depth in a future session.
No, thank you both, and thank everyone for this thoughtful discussion. And if we didn't get your question, we apologize. Feel free to follow up with our speakers after the session. And before we wrap the Q&A segment, I just would like to give the floor one last time to our speakers. So it's a quick question. So what's the one thing you want the audience to take away from today's conversation? If there's that one thing, what would it be? So who would like to start, Mikey?
Yeah, I'm happy to start.
Yeah.
I think that it's a process, so that you're likely to start at different stages in that process towards to forming a fully formed partnership. But it's a process that can be explicitly supported by an external agent to achieve success. It's not something that happens organically necessarily. It can, but it's more likely to happen if you have an external facilitator supporting that process and specifically building capacities towards organization as a partnership. That's my one point.
That's excellent. Sheyu, your take-home message.
Yeah, the take-home message is to, when you receive the request from the partner, the first is sit and talk and to understand the real need from the partner, but not only the request itself, and to do it in a sufficient way to make your living evidence ecosystem more sustainable. Thank you.
Great advice and great inputs from our speakers. And okay, so the survey is already, it's popped up on the screen. So we would love to hear your feedback to help us improve and better meet your needs. So please take the time to fill the survey. It should be available in the screen. If you can't see it, please let us know. And so while you are also filling the survey, if there's anything that really stood out to you today, a key takeaway, an aha moment, please drop it in the chat. We would love to hear it, or maybe even read a few out. So while you fill the survey, what was one main key takeaway that you got from this session? So this is for you, our audience. Feel free to put them in the chat and I can read one or two aloud. Okay. So in the meantime, okay. So Precious, will we have the results being displayed during the session, or will this be analyzed after the session?
We're going to share the results with the feedback we're going to give for the overall meeting.
Okay, that's great. Okay, so to the audience, what resonated most with you? Any aha moment you would like to share? So we typically like to take one or two inputs or insights, closing insights from our audience as well. Anything you would like to share, any reflection, just put it in the box and I can read it. And in the meantime, we can share with you the upcoming sessions for the Alive Forum. So as you can see in the slide, we have a list of sessions that are upcoming between May and August, and these reflect the different types of sessions, from Alive Discusses to Alive Talks to Alive Learns, and you can learn about the different modalities in our website. And as I mentioned earlier, the Alive model is built to be dynamic. So we want to co-produce the agenda with you. So if there's any topic, any idea, any session you would like us to put in the agenda, or maybe you would like to contribute, please reach out to us and we would very much welcome that. So for the next session, so the next slide. Okay, so it's going to be 28 May 2025, Living Evidence Partnership in Education. So this is a nice contrast between the example we had today when it comes to the clinical field, and now moving into the educational sector. We can compare and contrast how that partnership converges or diverges across the different sectors, and it will be chaired by one of our co-chairs, Tamara Credo. And with this, I would like to thank all of you for attending this session, for your thoughtful feedback and for your participation. Certainly today we explored what a living evidence partnership is, how to establish one, and how to sustain and scale it. And a huge thanks again for our speaker, Dr. Mikey Rosato and Dr. Sheyu Li, and to everyone here for helping us and for being part of this Alive movement. Until next time, take care and stay engaged. Thank you, everyone, and have a good day, good night, good morning. Thank you.